Good evening. So my story is, about all my patients that I serve. When I was in training at the same university that just sponsored the last commercial, I had a lot of things that I had to learn in the NICU. And taking care of babies is very special for me. But taking care of babies like the one you see here, her name is Amory. And when I was in training, I could see babies like her that were born a term, otherwise with a bright future ahead. And but she had a problem with her intestines, and she couldn't tolerate feeds. And these babies, when they don't tolerate feeds, then you have to be able to feed them from somewhere else. So you can see then she had an intravenous or a vein with access, which I will just call it IV. And then she was getting IV nutrition. But over time, all of these babies end up developing significant liver disease because they can't tolerate feeds for a long time. They need the nutrients, and they need these nutrients through the IV to survive. But then at the end, that ends up damaging the liver. So other babies like her were born at a different time. This baby, Jailene, was born in 2014. So before, the babies like Amreen used to succumb to the liver disease and not be able to survive because they were waiting for transplant, and they will pass before they could make it to transplant. For Jailene, it was very different. Jailene was born again in 2014, and then we had a therapy that was available for her. During this year, then she was able to be enrolled in a clinical trial, that it was a compassionate clinical trial. What that means is that there's no hope for these patients, and they need other therapies that, we don't know what they're going to do. It's really an experiment. So babies like her inspire me to look at something else that we could do for them. So what happened is that we had a research team readily available to do a lot of things. This research team had, bright physicians, determined dietitians, research nurses that were perfectionists, and administrators that were willing to help us. And we thought, well, there's this therapy that, there was a couple of kids in Boston that by serendipity were receiving a different type of IV nutrition with IV fish oil. And they saw that the liver disease improved. And when the liver disease started to improve, then they continued to use it in a couple of other kids. But this IV fish oil was not available in the United States. They had to import it from far away, from Germany. It was not FDA approved. And during this time, the team of researchers that we had, we said, well, in 2008, they reported more cases that the liver disease was improving, and the babies were not succumbing to liver disease anymore. Why don't we try it, and let's send things outside the box, and let's apply for the drug. So in 2009, we applied for an FDA approval, and we were able to get through a lot of hoops and loops, and then Salia came and joined our team, and she was the first baby ever enrolled, and the first baby in San Antonio that received IV fish oil. When she was born prematurely, and she had a severe disease of her intestines, and it was very rare, that will cause her intestines to be severely dilated, and she couldn't tolerate any feeds. And she was sent to us because she had no options. So she survived, and she stayed with us for about a year, and she ended up going home, and she continues to thrive. After her, we had a couple of other babies, but one of the most memorable babies that I remember is Luther. Luther was a term baby as well, who unfortunately had an intestinal disease as well that had severe consequences, and he lost the entire bowel. Otherwise, he was healthy and he was turned with a normal brain and with no other problems. So we started the therapy on him, and this is the cases and the patients that we take care of that gives us and makes us all of, thrive through research to try to get all of this therapy from all over. We went through a lot of problems, but we were able to get the FDA to approve it. And a lot of it was through the research office from the university that helped us to get all of that paperwork and all of the things together. After Luther, we had Anna, and then after Anna, then other babies kept on coming. So we had many babies like Delia, for example, that had prematurity, had a lot of intestinal disease, and otherwise she wouldn't have been able to survive. But then instead, she became a little mermaid, and we were very happy to see that. And then she continues to thrive, and she's 3 years of age now, and she continues to get better. So we were wondering at that time, well, we have this therapy. Now we were able to get babies that were otherwise, they had no hope. We were able to get them to survive. And kids like Gail, he looked so good. He looked completely normal otherwise. And he was able to grow to get to transplant. And in fact, he never needed a transplant. Before, we used to need transplant for all these kids. But then he gave us more questions of, well, what happens to these babies long term? Is this therapy causing any other effects? So we needed those kind of answers for the FDA, because the FDA needed to know if this could be approved for all babies in the United States. So another kid like Alfredo, he also had the same problems, and as you can see, he's older here because we followed these babies for years. We are very lucky to have a long-term developmental program at the University Hospital, and this program provides a lot of help for all the babies that are at risk for having growth problems or developmental problems, and we have a team of nutritionists, of developmentalists, and other physicians that take care of them. And we had all these numbers put together. And once we got all the numbers, then we were able to provide more evidence to the FDA that this was a good thing and that we found no long-term effects. I wanted to get more things because I kept on getting pictures from these families that went to Disney, and I wanted to tell the FDA that as well, that we had all these babies that were surviving, were able to thrive normally. But we, in conjunction with other researchers in the country, we were able to produce papers and to put it in writing. And in 2017, we were able to compare all of these babies to a big cohort of patients that developed normally otherwise, and we found that so far, there's no long-term side effects. So why am I putting an X-ray, since I know that not everybody is going to be a doctor here, and then we have a different type of, we have engineers, we have all kinds of people that may not understand this, but the IV fish oil gave us other things as well. Besides giving the patients hope, it gave us time to get the bowel, to get rehab. As you can see, this baby was actually the x-rays from Celia, from the first baby that we enrolled, and her intestines were severely dilated that we couldn't do anything. But with the IV fish oil therapy, it gave us time to get that bowel to get back to normal. It took us a long time, but it gave us that time. And other kids, the stories keep on coming, and this does not, all the pictures that I'm showing you is not going to make justice to all of the patients that we enrolled. We have a lot of people that participated, and the university hospital, and the nutrition center, and all of the different faculty that helped me to get all of these patients on board and treat them. It's just a group of San Antonians that really wanted to do offer hope and make a difference on the life of these babies. The parents as well, they really believed in us. They even made T-shirts with the IV official name in the front of it when they came to visit. The parents from Luther came back when he was 7 years of age, and when he was transferred to us, they were told that he wasn't going to survive and that they had to let go. And they trusted our trial. They trusted our ambition to get his kid to survive. And now he's 7 years old. He has a normal development. He goes to school. And he goes to school every day with an IV nutrition in there, but he's still thriving, and he still has not required transplant. So I show you this picture because it's in 8 minutes. I was given 8 minutes, and I am a physician. I cannot do this in 8 minutes. But I tried really hard to cut it short and to try to tell you our story. I cannot make justice to the 64 patients that have been enrolled in this trial with my little stories that I showed you. I can just tell you that just thinking outside the box, explaining others why we have to try and we have to do more, why we have to do research, it pays off. I came to this university because I wanted to teach, I wanted to make a difference, I wanted to advance medicine, and I just never dreamed that I was going to do such a big research project, and not in my wildest dreams I imagined that this was going to turn into 64 patients that are alive now because of this study. And I want to thank the university and University Hospital for believing in this research project, for supporting the project for so long with minimal funding to no funding, and for allowing us to continue to provide this service for the patients. So I think just thinking outside the box, believing in something and trying some things that are new, even though they're scary, I think that eventually it pays off. Thank you.